For more details about the COVID-19 situation in the United States, we are now being joined by Jagriti Dave live from Washington, D.C. Jagriti, thank you so much for joining us. Tell us, it seems that the biggest single-day surge with more than 50,000 COVID-19 cases has been recorded for a second consecutive day. And Dr. Anthony Fauci is saying that the country is not heading in the right direction with respect to tackling this outbreak. So what's going on and what can this sudden surge be attributed to?
Yes, the numbers are truly worrying in many parts of the country. You've got almost 8,000 cases in Texas on Thursday. You've got more than 10,000 coronavirus infections in Florida in one day alone. So these are startling numbers, and there's differences between the first surge that we saw in places like New York City, which was the epicenter in the United States earlier on in March. And those often were confined to hotspots in specific areas, whereas here you're seeing much sort of wider group of people affected by this. And really, there's lots of different things that are being attributed to, that the surge is being attributed to. I mean, the Trump administration, for example, is maintaining that the increasing number of cases is due to the increasing number of tests. And whilst experts do agree that there is more testing that's being done now than there was, say, a few months ago, there are just too many positive cases for this just to be as a result of increased testing. Indeed, one of the members of the task force, one of the people who's in charge of testing, Admiral Girard, he said that there was an increase in the number of cases. The numbers were pointing to that. He testified in front of Congress saying as much. So there's a variety of reasons. A lot of it is not the lack of social distancing, potentially. Also, a lot of these states, some health experts say, reopened too soon.
Right. I imagine a huge concern right now for the Trump administration as well as the people of America at large would be the upcoming July 4th holiday weekend celebrations. So what are the concerns in the country as of now? We know that social distancing norms are being flouted in across some beaches and bars. So as we head into this weekend, what can we expect?
Well, if we look, we've had several holidays leading up to July the 4th. You've had spring break where young kids went to the beaches of Florida and Cancun. You had Mardi Gras where partygoers took to the streets of New Orleans, and you had Memorial Day where tons of people went swimming in pools in Texas and California and Florida, and those really did, some experts say, were disastrous for curbing coronavirus. So people are expecting similar things over the weekend. Usually 4th of July is a huge holiday. It's barbecues, grills, outdoors, people gathering in large groups outdoors to watch the fireworks. Here in Washington, D.C., the usual thing to do is to go to the National Mall and watch the fireworks. But the mayor of D.C. has said, asked people to stay indoors. Nonetheless, the Trump administration is talking about a big fireworks display and a big flyover for the 4th of July, despite these concerns about the lack of social distancing and the spread of the virus that's being seen in other parts of the country.
Right. My final question, this sudden single-day surge also coincides with Trump's announcement that the economy, in fact, is on the mend and it's recovering. And Joe Biden, on the other hand, says there's no reason to celebrate. So there seems to be some mixed messaging when it comes to the situation in the U.S. So what really is the true picture?
Well, it's difficult to say how the country can really recover without jobs, people going back to work, and without the economy's reopening. But as we've seen, states reopening, some health experts are saying, is part of the reason why there has been a surge in the number of cases in various states across the country. So whilst 4.8 million jobs in June is better than expected figures, there are still 18 million unemployed Americans, and it's that balance that states and the federal government have always had to strike between public health and the economy. And it's a difficult game. It's a difficult decision to make. But at the moment, you look at the surge in cases, you look at the peaks in hospitalizations in states like Arizona and Texas, and it's difficult to really keep an economy, keep a state open when a virus is spreading as severely as it is in these states.
Right. All right, Jagriti, thank you so much for joining us and for all your inputs on the story.